Hello and welcome to Jersey Matters. I'm Larry Mendte. On this week's show, positive news about a COVID-19 vaccine has states trying to figure out how fast they can distribute it. We talked to Dr. Don Liss, Chief Medical Officer at Horizon Blue Cross Blue Shield, New Jersey, about just that. Bars and restaurants face new restrictions after a COVID surge in New Jersey. We talked to Mary Lou Halverson, President and CEO of the New Jersey Restaurant and Hospitality Association. Legalized recreational marijuana is coming to New Jersey. Axel Owen, who led the campaign to make that happen, tells us what it means for the state. And you want to go out and you're not sure what's safe? How about a New Jersey winery? But first, here's my interview with Dr. Don Liss, Chief Medical Officer at Horizon Blue Cross Blue Shield, New Jersey. Doctor, thanks for spending some time with us. I do appreciate it because I know it's a busy time for you. Let's talk about the big news from Pfizer, that they have a vaccine that they believe is 90% effective. Talk about the scale of that news. How big is that?
So that's a big deal. Yesterday was a great day for science. The announcement that a vaccine is showing really significant progress in human trials and being at 90% efficacy, far beyond what anyone had expected. Now, there's lots of challenges ahead of us. There's other vaccines that we hope will show similarly optimistic results. There are going to be all kinds of challenges in distributing this vaccine and others. There's going to be challenges in making sure that the science is sound and that when experts get the chance to completely review all the information and data collected in the clinical trials, that it proves out. But yesterday was clearly a big moment.
You said a couple of things that were hesitant. I mean, a couple of things that would give some pause in thinking this is done. This is a done deal. You said progress so far, and then you said if it proves out at the end. So this isn't done. We shouldn't be excited like, okay, we have a vaccine coming in a couple of weeks.
Yeah, I'm sorry to say we're not quite ready to spike the ball, but let's point out a couple of things. One, this trial, the information that was released yesterday was based on a total of 94 cases of COVID-19 being identified in the 43,000, give or take, individuals participating in the trial. So the good news was that 90% of those individuals who got COVID, so of the 94 people who got COVID, 90% of them were in the group that did not get vaccine. That's great news, far beyond what anyone expected. But let's remember, this is 94 people. The entire trial that upon which the FDA will consider emergency use authorization is going to be based on 164 cases. So again, these are unprecedented times, but we need to keep that in perspective.
The other 42,000 plus people aren't insignificant, though. We just don't know. We don't know if they were protected or not.
Well, the way the trial worked was approximately 43,000 people were recruited. Half of them got vaccine and half of them did not. And those 43,000 people went about their everyday lives, just like you and me. And some of them were destined to get COVID-19. So this was a moment in the trial when the data monitoring committee at Pfizer reviewed its experience and learned for the first time that 90% of those who got COVID were unvaccinated. That's great news. That shows that the vaccine essentially works in preventing COVID-19 in the vast majority of people. Now, it's not 100% effective, no vaccine is, but most experts were predicting something on the order of 50, 60, 70% efficacy, and 90% was frankly a pretty big surprise.
How are you going to get this to people? Is it going to be done fairly quickly? What are your hurdles?
So first of all, the delivery of vaccine, at least the first 100 million doses, is going to largely be handled by the federal government. So as part of Operation Warp Speed, the federal government literally paid in advance, procured the first 100 million doses from Pfizer. And the federal government is literally going to be figuring out how to get it delivered to vaccination sites so that initially those highest priority for vaccine are receive it, and eventually the entire public is eligible to get vaccinated. So initially, we expect that the federal government and each state has some discretion in establishing its priority populations, but is going to concentrate on people residing in nursing homes and other congregate living arrangements, healthcare workers, so that they're available to care for others that become infected, those with chronic illness, those in essential jobs so they can continue to serve the population, and then eventually the entire population. The challenges in doing that are protean, but include, in the case of this Pfizer vaccine, the necessity to maintain what's called ultra cold chain distribution. The vaccine has to be kept at minus 95 degrees during transport and until a couple of days before its use. And that's not something that's typical in the healthcare system today. And then the typical challenges in administering any kind of medication on this sort of grand scale, identifying those what are called mass immunizer provider entities. So be it public health departments, be it retail pharmacies, for example, be it physician offices and other similar places where you and I might get our flu shot now. But figuring out how to deliver vaccine, how they need to be organized to administer it, have the supplies that they need, the personnel available, be able to deal with the different priority groups as they come to receive vaccine, keep track of it, because this Pfizer vaccine, for example, requires 2 doses 21 days apart. And that obviously is yet another wrinkle. So again, nobody should declare victory, but the good news on the science side is that the trials show the vaccine seems to work.
Is your company on the sidelines in all of this? You said that the federal government takes over in the beginning. Where do you play a role?
So we play a couple of roles. One, just generally as part of the healthcare system in the state of New Jersey, promoting appropriate care, making sure that we're messaging to our members, we're coordinating with our provider networks to be prepared and eventually to make sure that the vaccine, whatever vaccine comes to market, are distributed appropriately. First and foremost, our job is to make sure we're prepared to handle the administrative burden of paying the claims that mass immunizers are going to incur in administering this vaccine.
All right, sir. Thank you so much. By the way, I'm a member, so I look forward to the guidance that I'll be getting. Thanks for your time. That was Dr. Don Liss of Horizon Blue Cross Blue Shield, New Jersey. When we come right back, we'll talk with one happy man. Axel Owen led the campaign to bring legalized recreational marijuana to New Jersey. He's next.